welcome to Med Madness. Today we're diving deep into the rapid waters of transplant medicine with a focus on hyperacute rejection. Let's kick things off with a USMLE Step 1 style question. Imagine you are in the operating room and a 45-year-old male is undergoing a kidney transplant. Moments after the anastomosis of the donor and recipient blood vessels, the kidney turns cyanotic and mottled. There is immediate cessation of perfusion and no urine output. What type of rejection is likely occurring and what is the mechanism behind it? If you guessed hyperacute rejection, you're right on the money. Now let's unravel why this happens. Hyperacute rejection is a dramatic and immediate response that occurs in organ transplants, most notably in kidneys. It's classified as a type 2 hypersensitivity reaction, which means it involves antibodies that the recipient's immune system has already formed against donor antigens. These antibodies could be anti-HLA or anti-ABO blood group antibodies. HLA, or human leukocyte antigens, are crucial for immune system functioning, helping the body distinguish between self and non-self. Mismatches here can provoke a strong immune response. Similarly, ABO mismatches can be just as problematic. When these preformed antibodies in the recipient bind to antigens on the donor kidney, they trigger a cascade of immune responses. This includes the activation of the complement system, leading to inflammation, vascular injury, and thrombosis. The result? The blood vessels clot, blood flow is halted, and the transplanted kidney rapidly undergoes ischemic necrosis. Essentially, the organ dies due to lack of oxygen and nutrients. Clinically, this is seen almost instantly in the operating room as the kidney turns blue and mottled, a telltale sign of hyperacute rejection. Sadly, this type of rejection leads to immediate and irreversible graft loss. To avoid this, transplant teams perform extensive pre-transplant screening, including ABO and HLA cross-matching. This helps ensure the donor and recipient are compatible, significantly reducing the risk of hyperacute rejection. So, back to our question. The scenario described in the operating room, the cyanotic mottled kidney with no urine output, is a textbook case of hyperacute rejection due to preformed antibodies attacking the newly transplanted kidney. That's it for today's episode on hyperacute rejection. It's a critical topic for anyone entering the field of transplant medicine and a crucial point of study for the USMLE Step 1. Now, we'd love to hear from you. Head over to the comments section and tell us what other topics related to transplant medicine would you like us to cover in future episodes. Your feedback helps us tailor our content to your learning needs. Thanks for tuning in. Please like, share, subscribe, and visit medmadness.co to buy the full immunology course.